Sumter and Hernando counties. And my partner is Taylor Davis. She is the Ag and Natural Resources Livestock Agent for Highlands County. So we teamed up today, and we're going to talk to you a little bit about problems you might face when you're having calves at your place. So the first thing I want to talk to you about are the 3 P's of parturition. Does anybody know what parturition means? It's a very fancy word. You can impress all your friends.
Giving birth.
Yes. It's just a fancy name for saying we're going to have a calf, or the process of having a calf. Or it can be for any animal, really, just giving birth. So the 3 P's are, the first one is presentation. Then we're going to talk about position and posture. What way should a calf come out of a calf? Who can tell me? Okay, you want the head to come out, but what else? No, we don't want that. That would be horrible. Because we'd be calling the vet. Wait. What? Which legs? Front, that's right. And you actually did the correct shape. We want them to come out like Superman, right? Or look like they're about to dive into the pool, right? So this is the correct shape to come out. We want head and feet first, right? So bad presentation would be rear end first or side first. That's bad presentation. Well, we're going to go through that here in a minute. So, position. Are they on their back or are they face down? Face down. So the correct position is face down. Now, posture. If they're in that cow doing yoga, that's bad posture because we do not want the head tucked back because it'll get caught and won't come out. We don't want a leg tucked back. We don't want 2 legs tucked back. We want feet forward. So the correct posture is feet and head forward. We don't want anything else because you can see, like here's a bad posture right here, the head tucked back. It's not going to come out the birth canal that way. And I have this diagram here that shows you a whole bunch of bad ways to be coming out. And you can look at these if you want to while you're waiting to take your turn. Now, Ms. Taylor's going to talk to you now about some other things you need to be concerned with concerning the calving process.
All right, good morning. I'm Taylor Davis. Does anybody know what the word dystocia means? No? All right, so dystocia is, you do know?
Is it like difficult calving?
Difficult during birth, right? So that can be humans, animals, but calving for cows and heifers, that's right. All right, so pre-test question. Does anybody know what the #1 reason for dystocia to occur is? Which answer? Size, that's right. That's the #1 reason. So the reason is because a lot of producers, are like, oh, we need a new bull. Let's go to the bull sale. I'm looking at their EPDs. Oh, this one has the biggest birth weight, and that's what I'm going to make my money off of because it's most pounds per dollar, and that's what drives the market is pounds. That's what I'm going to get. All right? A lot of issues that they run into is they don't take into consideration the size of their cows or their heifers at their place, the age of them. A lot of times, and it happens, it just happens. A lot of times when we get heifers, we'll think, oh, they're breeding, like, we're going to breed them. You got to look at their genetic makeup. If they're not a certain size of what they're supposed to be, they can have a lot of issues delivering that calf. Okay, so we have the pelvic bone that sits right here. If they're not at a certain age of maturity, that bone isn't developed big enough to push that calf out. Okay, so that's another issue that we run into. But the #1 reason, that's right, is the size of your calf. Okay, so before I put my gloves on, does anybody see anything wrong with my arms or hands? Well, I'm going to put my gloves on, but before I put my gloves on, what's wrong with my arms and hands?
You got rings.
I got rings on, right? Okay, before you put your hands in any animal, always, if you got rings on, take them off. If you got long fingernails, if you can clip them real fast, that's best. Don't go in with any bracelets, watches on, because what it does is it can tear the inside lining of this animal, okay? That can also introduce more bacteria, more infection probability. So always, always, always take anything off your hands. Short fingernails is the best. So you see this jug sitting by Miss Laura's feet. That's a jug of blue lubrication. Okay? when you're dealing with an animal, you want it as slippery and slidey as you can possibly get it. You can never use too much lube. You want it slippery and slidey because, just like with the rings and fingernails, you do not want to tear any tissue. There's going to be tearing probably, but you want to minimize it as much as possible. So lubrication is definitely needed. You can get it in a jug like that. They make the powdered version. You can mix with water. Any type of lubrication will work. You can never use too much. Now, for today's demonstration, we just opened her up and dropped lube in there. But in real life, you cannot do that. So what you would typically do is, and a lot of times you don't have gloves in the pasture. It happens. You just want to make it as sanitary as you possibly can. If you got hand sanitizer, try to do the best you can. You got some soap in a pond, I don't know, maybe do a little hand washing. But typically you would take the lube, you would lube up your arms and your hands. I like to do a good butt, vaginal pat right here. Really, really try to push that lube in as much as you can. So when you have a cow or a heifer in distress, the first thing you kind of want to do is evaluate her, all right? You know, as humans, a lot of times we like to jump in quicker than what we should. So it all just kind of depends on how long she's been in labor, but you want to evaluate her, okay? So you want to take your hand and you just kind of feel around, right? It's easy because you can see it right here, but in real life you can't see it typically, or sometimes you can. But you want to feel around, okay? Got one hoof, all right? Where's my other hoof? There's my other hoof. I got a head, okay? This is good presentation right here. She is in the diving position, okay? Oh, she just cabined herself.
She had a contraction.
She had a contraction, right? That's another thing to think about. Is this animal naturally is contracting? That body is naturally trying to push that baby out. So you always want to work with the animal, never against her. Who here has had to pull a calf before? If I show hands. Okay, we have a few, okay? Who here has used OB chains? A couple? All right. So OB chains, there's a picture over there if you want to look at them. It's a chain, and the tool is an extender of your arm, okay? So you wrap it around the hooves, or the legs, not the hooves, the legs, and you want to walk that baby out with those chains. A lot of issues that we run into is people like to take those OB chains and hook them to a piece of equipment, hook them to the truck, a tractor, the gator, a four-wheeler, and just yank this sucker out, okay? Does a lot of damage to this mama cow. Again, think of contractions. You want to work with this mama cow. If you just yank her out, you can tear you can do a lot of damage on the inside of this mama cow, okay? That's why it's important to use those chains, because you can feel what this mama is doing the whole time. Contraction, okay, walk. It's done. The contraction's over when you take a break, okay? Another contraction, walk. Okay, take a break. All right? So that's also something to consider. Don't use OB chains and hook them up to a piece of equipment. Okay? So whenever you are pulling a calf, you don't want to just pull both legs at one time. On a calf, the widest part of it is its shoulders, okay? And there's a bone here, the pelvic bone. There's only so much area within that pelvic bone. And you're working bone against bone. Okay? So when you walk it, you're going, walk out of this. You do one arm, and then the other arm. One arm, and then the other arm. I don't want to figure all the way out for time purposes. But what you're doing is you're taking that shoulder, and just like when you're walking through a door frame, you kind of finagle your way through. Same thing, you're walking those shoulders through that pelvic bone. Alright, so today what we're going to do is we're going to be a little tricky. We're going to take Lulu and her baby, and we're going to move the baby around. You might have a head back, a leg back, a upside down, the true breathing, the tail coming out. And what your job is to stick your hands in without cheating with your eyeballs and feel around and tell me what you feel. And how would you fix it? Can you give me a head back? Alright, so let's just say you run into a head back situation. Alright, I put my hand in. Okay, I got two hooves, they're right side up. You're straight. Okay, I got a head back. But she's so far in this birthing canal that there is no room to take that head and whip it around. Okay, I know it sounds counterintuitive, but what you're going to do is you're going to push this baby back inside the mama. It gives you more space to grab that head, to grab the mouth and the nose, and whip it around. Okay? Whip it around, and now she is in the Superman position to deliver. Alright? So that's something to keep in mind when you stick your hands in. Okay? if you want to give it a try, go ahead and line up. And hold on, yes, ma'am, you got a question? Oh, okay. All right, go ahead and line up and I'll give some y'all some gloves.
Yeah, no cheating now.
Another note, ma'am. Lay it down.
Yeah.
On your bed. All right? It's very, very important.
Okay, so you only have one, so find where's the other one. Yep, keep coming.
To have a relationship with your mark in the bed. Because if you run into the situation that's 2 a.m. and you get real slow, you're really hoping that they
Got it?
okay. All right.
We gotta go. All right.
All right.
You're good. Everything's good.
You good? You got 2 legs ahead.
Yep.
What do? You walk it? Yeah, you would walk it. Low into it. Nope, we're reloading for the next. No, you want to work with gravity, right? You don't want to be yanking up against gravity because naturally, this animal is just going to fall out. And usually, once you get those shoulders through, the rest of the body just slithers on out.
Okay.
Okay? All right, tell me what you feel. Now, what's the head? Yeah. Where's the head? The head. Okay, so the head's back, right? Right here. What would you do? Grab its nose and its mouth. There you go. You have all 3 parts ready. Good job. And then you walk it, right? One foot from the other. Good job. Right? We're going to reload it. Right? Tell me what you feel. Okay. Ready? Go ahead. Okay, where's that other hoof at? You go with that 1 or 2? There's this tiny toe. Okay, so what would you do? Okay, you walk it out, right? Good job. Okay, hold on. Okay. Right there. Okay, what would you do? Okay, where would you grab that head? That these are really sharp. So when you're swinging it around, you want to cup it as much as you can to protect the body there. Okay, so is it whipped around? Okay, so is it ready to deliver? Good job. Right, come on, here. Okay, so head facing you. Okay, so we're going to do how many toes up? Yeah. Good 4. Nice. Okay, hold on a second. Okay. Tell me what you feel. For the head. This way's not. Okay, do you have enough room right there? Okay. All right. Now it's just this here. Okay, so then you deliver, right? Good job. All right, we're going to reload it for the next one. Okay, ready what you feel. Go big. Okay, you go 1 hook or 2 hooks. Is that hook, is she like this? Or is she like this? How do you think of that? Yeah, on your chin. And then on that hook, is that little paw? Like the long part of her hook is upside down. Okay. So what would you do? Okay, so this baby is upside down like this. Alright? This arm is down like this. In that situation,
He's in a bad situation.
you might look